Clostridioides difficile infection, or CDI, is a major health issue worldwide. The US alone reports up to 30,000 deaths per year and more than $4.8 billion in acute inpatient costs. What's more, patients carry a substantial risk of recurrent CDI, especially older adults. To address the problem of recurrence, we recently explored the safety and efficacy of RBX 2660 in patients participating in a Phase 3 randomized clinical trial. RBX 2660 is a microbiota-based live biotherapeutic that is rectally administered for the prevention of recurrence of CDI. The formulation is made up of a broad consortium of microbes, rigorously prepared and screened for pathogens from healthy donors. Biotherapeutics, like RBX 2660, have been found to restore the diversity and composition of the gut microbiota. That makes them unlike antibiotics, which are the standard of care treatment but can cause gut dysbiosis, laying the foundation for recurrent CDI. Our recent Phase 3 trial, PUNCH CD3, demonstrated the superiority of RBX 2660 versus placebo in patients with recurrent CDI. Patients were adults from the US and Canada who had at least one recurrence after a primary episode and had completed at least one round of standard of care oral antibiotic therapy, or had at least 2 episodes of severe CDI resulting in hospitalization within the last year. Patients were randomized 2-to-1 to receive a single dose of either RBX 2660 or placebo via rectal administration. The primary endpoint was treatment success as estimated by a Bayesian analysis approach, which was defined as the absence of diarrhea related to CDI within 8 weeks of treatment. The Bayesian analysis estimates of treatment success rates were higher for the group receiving RBX 2660 versus placebo, 70.6% versus 57.5%, representing a treatment difference of 13.1 percentage points. In addition, approximately 90% of patients across the RBX 2660 treated and placebo groups who showed treatment success at 8 weeks remained free of CDI recurrence for 6 months. Over the 6 months of follow-up, a higher rate of adverse events was reported for the RBX 2660 group, driven primarily by patients experiencing a mild event with maximum severity. Notably, no serious adverse event was related to the study treatment or method of administration. The safety profile of RBX 2660 may be attributed in part to the rigorous preparation and screening of donors and samples, which help prevent the transfer of any pathogens. The higher response rate observed for the placebo group may be attributed to the fact that the PCR assay, the most commonly used diagnostic tool, was used in more than 70% of patients, which may have resulted in false positives in some cases. Additionally, approximately 1/3 of patients were enrolled in the study after one recurrence of CDI. Despite these limitations, the results suggest that RBX 2660 is superior to placebo in preventing recurrent CDI. Overall, the findings expand the body of evidence, demonstrating the benefits of RBX 2660 for adults previously receiving antibiotic therapy.